The National Emergency Medical Services Information System, Nemsis, is the largest database of emergency medical service activations in the United States, with tens of millions of records collected, stored, and shared each year. States in green are currently submitting data to Nemsis. The Nemsis Uniform Dataset and Database help local, state, and national EMS stakeholders more accurately assess EMS needs and performance, as well as support better strategic planning for the EMS systems of tomorrow. Data from Nemsis are also used to help benchmark performance, determine effectiveness of clinical interventions, and facilitate cost-benefit analyses of EMS system configurations. In 2019, there were over 34 million EMS activations submitted by over 10,000 EMS agencies servicing 47 states and territories. How does it all work? It begins with an activation. An activation is an occurrence which initiates an EMS response with the potential of patient medical care. This is also referred to as an EMS call or run. An activation can include 911 calls, critical care transports, interfacility transports, scheduled transports, or standby events. EMS clinicians document these activations as part of a patient care report. When complete, the patient care report is transmitted from the EMS agency to the State Office of EMS. From there, it is sent to the National EMS Database. This automatic process happens within minutes of the clinician closing the patient record. Information collected on patient care reports represent local, state, and national level data elements. Only national level data are sent to the National EMS Database. Nemsis receives that data. It is cleaned, stored, and shared with the public. Information identifying any agency, clinician, or patient are not made available to the public. How can the data be applied? The Nemsis data can be used for public health surveillance, EMS resource allocation, evaluation of clinician performance, EMS system performance, academic, clinical, and public health research. Here are some examples of valuable research completed using Nemsis data. For example, agencies systematically positioned services during a marathon. Researchers found ambulance seen to hospital transport times for pickups were 4.4 minutes longer on marathon days compared to non-marathon days. Another group of researchers found that the introduction of ride-sharing into cities across the U.S. has reduced the per capita ambulance volume by at least 6.7%. When it comes to public health surveillance, the Nemsis data are being used to track influenza-like illness activation hotspots and demands on EMS clinicians at state and county levels. And finally, the Nemsis EMS performance dashboards are based on the latest version of the National EMS Quality Alliance performance measures to assist states and agencies in developing interventions and protocols to improve quality care. There are many ways to interact with the data. The Nemsis Technical Assistance Center provides many public-facing tools to navigate the data. These tools include OLAP Cube to query, dashboards to view, and public release research data sets to analyze. If you have additional questions about the Nemsis data, reach out to the Nemsis Technical Assistance Center